What's the time? Good evening everyone, it's 2nd of June 2025, it's Monday, 8:47 p.m. and I just had my dental filling, dental bonding. Yeah, it's called as dental bonding. Like I had this, my teeth were perfect, but in 2020 I realized there was a small gap. It was developed between these front two teeth called as incisors here. Yeah, there was a very small gap, and means it was not very visible, and it till like yesterday, the day before yesterday, the last week, till the last week it was not very visible, and that's why I felt like let it be. But then when I, especially when I used to meditate and I was concentrating on my breath, my teeth are a little bit sensitive, not too sensitive, but when I was focusing on my breath, uh, the air through that gap, it was like irritating me. Like it was very irritating experience, and I used to get that weird sensation. I didn't like that. Means it could be ignored, it was not that. And whenever I used to make some videos, it was not that visible, but sometimes when I had close-up videos, it showed a little bit gap, and then I was like it was not there before. Means I never noticed. I didn't know if it was there before or not. Then I looked back at my photos 20 years back, 20 to 15 years back, and I looked at my teeth. Like my teeth were perfect. Then also there was some dental notching here, wear and tear of these incisors. I asked if it was because of the lemon water, warm water with lemon juice and honey and lemongrass I have. Like lemongrass, lemon water, warm lemon water I used to, means I have been having this for last, means from my age of 19, from my MBBS days, like from second year or first year, I remember I was having that lemon honey water in the morning from that time. So remember, like I was 20 years, from 20 years to this 38 years. Yeah, 18 years of exposure to citric acid almost every day in the morning, warm water along with warmness and that citric acid. So can you imagine? And that caused this gap, I think, and it was very little, it was not even visible. But then I felt like just I didn't like that gap because my teeth were perfect, so I wanted the perfect teeth and perfect look. So I asked him whether I should go for filling or not. Then he suggested me other, he gave me other option of invisible braces, which can be taken out. Like we are supposed to take them out for like whenever we are having food or whenever we are brushing our teeth, we are supposed to take them out. They are not visible. And but I didn't go for that thing. I just watched on internet like whether I should go for that thing just for a small gap. Should I just bear and tolerate that kind of, you know, uncomfortable life for like 6 months, taking out the braces, invisible braces and all, and like come on, like just for a single gap? No, I was like, I asked him that if we can go for feeling because it's very small. So he agreed, and he went for it, and he did such a good job. Like seriously, can you see my teeth? I should have, means I should have taken before and after photo. I have just after photo. Before photo is not very clear, but if you have my videos this year, you close-up videos, you can see there is a little bit of gap. It's not very visible. You will have to zoom it out, and then you will see there is a gap. And now it's not there. So I'm very happy that what structure I had in my MBBS days, or even in my teenage days. There was little gap here, but it got filled naturally as I grew. I saw it in photo. So after teenage days, like after 25 years, yeah, in at 25 years, what my age, like at that age, what my teeth were, what condition I had about my teeth, like they were perfectly aligned. They are perfectly aligned. Just a small gap was developed because of this wear and tear of teeth incisors because of lemongrass. So he told me, he gave me suggested. So I was like, should I stop taking the warm water citric acid or lemon warm water in the morning. So he was like, you can use the straw. Then obviously it's the common sense that you are supposed to use the stainless steel straw, which I just ordered from Amazon for 150 rupees. Some 8 straws are there, so I ordered them. And you can have them, like if you want to have the warm water citric acid or warm water lemon juice in the morning along with honey and lemongrass water, you can use this straw, because teeth are very important. Like 18 years of exposure to citric acid, and that caused little bit of notching of my teeth and little bit very small gap, and I didn't want it to go wide with the aging and with the time. So I felt like just closing it, and I closed it, and there is no that weird sensation and sensitivity when I'm breathing. It's not there, so I'm very happy. So you can go for it. Otherwise, I'm very happy and thankful to God and myself for my healthy dental routine, that I brush my teeth a day and night, like twice a day, or every day, almost every day. Like maybe 1 or 2 days I'm lazy, but almost every day I brush my teeth twice a day, and I don't have any caries, and rest teeth are perfectly aligned. So I didn't want a single imperfection in my teeth, because they were perfect. They are perfect, just a gap was there, so I felt like filling it. So the procedure I went through, it's dental bonding, they call it as, and there are different types. Like dental filling is there, yeah, dental bonding, then veneers. I don't know if I went through veneers or the dental bonding. The resin material was put, or thin custom made shells or porcelain or composite was used. So I think veneers, I don't know, but I don't know their charges because I'm a doctor. He said that the receptionist told me that he charged less amount from me because I'm a doctor. So yeah, otherwise his charges are really better, like than the what Metro City people they charge. Like I remember one of my relatives went to Metro City, and she asked the cost of these procedures, and they really cost more than 5,000 or 6,000 rupees, depending upon how much gap is there, of course, and whether it's one or even the side gaps are there, like canines and premolars and all. So I'm very happy with the procedure, and I'm just giving that doctor 5 out of 5 or 10 on 10 marks for this good job and good advice, and suggesting me other option also, like invisible braces. Like if you don't want to go for that, and if you the sensation, yeah, it's little bit raw. It's not, enamel is very smooth, but the filling material they use, it's not as smooth as enamel. So you might be uncomfortable, but I'm not uncomfortable, because it's not just feeling. For the one time I had feeling in between my molar and premolar. There were no dental caries, only the gap was there, and the food particles used to go inside that gap. So I felt like it was very weird for me. So I told him to close that gap, and he did. One of his juniors did that thing, so I'm very happy that it's not causing me that weird sensation. So I'm overall very happy the kind of treatment I got there, and that's why honestly I like private people. Not all private people are good, but some private people are really good. Like they talk to you in a very nice, affectionate way, and they respect you, they smile at you, they greet you, and also they don't charge so much from you. So I really liked it, and he took the fact into consideration that I'm a doctor, and usually doctors don't charge anything from the doctors that we during the oath, like when we take an oath, whenever we are given the doctor certificate. In that oath I remember that we are not supposed to, the etiquettes, we are not supposed to charge any fees from the doctors. So at least he's a private doctor, so at least he reduced the charges. So I'm very thankful, otherwise other doctors don't even consider that fact. So I'm very happy that I got a very nice treatment and I was not charged so much. And yeah, So my advice is, if you have this diastema, it is called as diastema, the gap between the front teeth, which are known as incisors, you can go through this procedure. It's absolutely non-painful, not at all, and it took just 15 minutes for me because the gap was very small and the notching was there. So it was divided into two settings. It could have been done in one setting, but it was divided into two settings. I don't know the reason, but it was divided into two settings, and I was fine with that. First they filled one notch and the gap, and then later on they went for polishing and filled the notch, the inferior notch, slight notch. It was not even visible at all, slight notch. And because the enamel was washed off or melted, underwent wear and tear because of that citric acid exposure for a long time, so the teeth inferior portion, little bit portion, got thinned, and it had notch, and that was contributing to the gap in between the two incisors. So I told you that if you want to have that warm water, lemon warm water in the morning, so go for straw, because it's really healthy. It really helps you to reduce your cholesterol level, obviously along with the diet and exercise. I have seen two of my relatives, like with this lemongrass honey warm water and garlic water, with exercise and proper diet, they reduce their cholesterol level from 190 to 110 or 90 level, something like that. So you can go for that thing. Don't stop having lemon water, but go for the straw. Just don't use it, like otherwise you will end up damaging your teeth, good teeth. So that was the one advice. And aesthetically, if you want to fill the gap, or even it's very irritating that through that gap, even the food particles sometimes they get stuck, and the air going through that when we are inspiring, because some air, it goes to the mouth also, even if the mouth is closed, so that causes the weird sensation. So for that you can go for the treatment, diastema. Either if you have weird teeth, like so many weird teeth, like not very much aligned, you go for braces. Yeah, for that. But just if you're like me, my advice is you just go for don't go for braces at this age first, and just for the one small gap that was not even visible for in my case. So if you have small teeth gap, you go for dental bonding procedure or this veneers rather than going for braces. That is my advice. This is what I think. And if you have misaligned teeth, like usually people have it from the childhood, so go for braces. It's as simple as that. So this video is for that. I have taken one photo, but that is not very clear, to show what my diastema looked like, mild gap in between the incisors and after the treatment. So if you want to get it done, if you want to go through this procedure, and if you have the diastema like me, you can go to Dr. Sunil Kate here in Sangli. He's a good doctor. He treated me very well, and he treats everyone very well with a smile, and the staff is also very good, very cooperative, and very like they greet you with smile, and even appointments around time. It's really good. Little bit 15-20 minutes here and there, but it's fine. Like overall I got a good treatment, and that's why I'm recommending you, and I'm giving him 5 stars. Okay, bye. Yeah, and I forgot to tell you one thing. Like if it is means he told me that it means the staining won't be there with the time, and how long it stays, because the gap was small, he was not sure about it. But let us see, because I had this filling procedures for the gap between, I think, premolar and molar, yeah, long back, and recently also. So it is still there, so I think it will be there. After 1 year or after 6 months, I will tell you the condition of this filling material, if it is there, and it's very small, if it is there or not. For that I'll make another video, but right now I'm feeling very happy that my gapless smile is back. Back. 부를 거야. 아마 날 부를 거야.
밤을 울었어